Magandang araw po mga kasambahay and welcome to another episode of your favorite health and medical program. Ito po ang Doctors on TV. My name is Dr. J.M. Ko. Joining me today, my co-host, Dr. Lady Ruby Tagulao.
Hi, Doc. Good morning again.
Hello. Good day. How are you?
Mabuti naman. Ikaw, na-miss ka namin, ah.
Yeah, I was absent for a while. But now I'm back.
Yeah.
Regular na naman.
Huwag ka nang muna alis, ah.
And it's going to be another exciting episode,
Yes.
Doc Lady. We are here at the Fatima Eye Laser Center of the Fatima University Medical Center for another episode on the eye.
Very interesting kasi actually mamaya, no, makita na may patient talaga tayo na for malalaman nila, LASIK surgery.
I just think the people joining us from Tawi-Tawi Medical Center, thank you for your weekly support. I'd also like to invite you to join us in our social networking sites. Please like us on facebook.com/doctorsontv. Follow us on twitter.com/doctorsontv. Watch us live streaming online, www.untvweb.com. Our past episodes are uploaded there. And also email us at doctorsontv@gmail.com. Our topic for today, refractive eye surgery or femto-LASIK. Panoorin muna natin ang video na ito.
Ayon sa World Health Organization, tinatayang 285 milyong tao sa buong mundo ang may deprensya sa paningin o visually impaired. 39 na milyon ang bulag at 246 na milyon naman ang may low vision. Bagamat 65% ng may deprensya sa mata ay ang matatanda, tinataya na 19 na milyong bata, edad 15 pababa ang mayroon din ito. Ang pangunahing sanhi ng visual impairment ay ang refractive errors na bumubuo sa 43%. Samantalang 33% naman ng causes ay ang unoperated cataract at ang nalalabing 2% ay dahil sa glaucoma. Para mai-correct ang refractive errors, maaaring magsuot ng eyeglasses o kaya naman ay contact lenses. Subalit kung ayaw ng pasyente sa ganitong paraan, maaari silang mag-undergo sa refractive surgery. Sa refractive surgery, mayroong iba't ibang surgical procedures upang i-adjust o i-correct ang focusing ability ng mata. Kaya alamin natin ngayon sa mga medical experts ang iba pang detalye at kung paano isinasagawa ang femto-LASIK eye surgery. Dito lamang sa Doctors on TV.
At yan po mga kasambahay ang topic natin for today, refractive eye surgery. Of course, to help us understand, we've invited an expert in the field of ophthalmology. He's actually the president and CEO of Fatima University Medical Center, Dr. Vicente Santos. Hello, sir.
Hello, good morning.
Hello, sir.
Thank you for having me.
So, Dr. Vic Santos is an ophthalmologist. He's a vitreous retina specialist, refractive surgeon on LASIK. He's a member of the American Academy of Ophthalmology and a diplomate board member of the Philippine Academy of Ophthalmology. Dr. Santos, thank you for inviting us here.
I'm glad to be here. Maraming salamat.
At salamat po dahil lagi nilang pag iniimbitahan namin kayo, talagang laging available.
Ganun lang naman po ang suporta ng Fatima sa UNTV at tulad ng suporta niyo rin
Lahat po ng pasyente talaga namin ay alagang-alag.
Thank you very much po. I'm glad to help.
Oo nga. So Doc, no, para sa ating mga viewers, ano po ang ophthalmologist at anong difference ba sa mga optometrist? No? Kasi mga ibang tao nalilito.
Okay, it's good that you mentioned that. Yung pong difference ng ophthalmologist tsaka optometrist, an ophthalmologist is a graduate of the College of Medicine. So, diretso po silang naging doktor at saka lang po sila namili na gusto nila maging eye specialist. On the other hand, yung optometrist, doktor din ang tawag pero sila ay dumaan sa Doctor of Optometry. So wala ho silang background sa medisina. And that's the reason because we can cure eye diseases. They can do the refraction. So eyeglasses and contact lenses.
Okay. And Doc, we're very impressed with the facilities here at Fatima University Medical Center. Modern na modern. Everything looks high-tech. Ang ganda ng facility. And even the university looks good. No?
Maraming salamat. We try our best po.
Okay. So actually, no, dagdagan naman kasi akong tiyahin na ophthalmologist. And I asked her, no, why ophthalmology? Kayo, Doc, why ophthalmology of all the specialties?
Well, I was fascinated by the specialty. Ako po ay naging intern sa St. Luke's at doon nakita ko po lahat ng mga gamit para gamitin sa napakaliit na bahagi ng katawan. No? Yung mata. Napakaliit pero napaka-importante. At doon nakita ko kung paano nagagamit ang iba't ibang klaseng teknolohiya para masiguro na malinaw ang nakikita ng lahat ng tao. And because of that, I was inspired to become an ophthalmologist. At kung ano yung gamit sa best centers in the world, we try to duplicate it here in Fatima.
And I'm sure, no, giving someone the gift of vision,
Apo.
I'm pretty sure, iba yung feeling. Ayan. So mga kasambahay, wag po kayong aalis, no? Kasi magandang talakay natin ngayong araw na to. Pero panoorin muna natin kung ano nga ba ang mga bago sa mundo ng medisina dito lamang sa Health Update.
Pag-aaralan ng Department of Health ang posibilidad ng pamamahagi ng halos 600,000 dengue vaccine na hindi nagamit matapos ang isinagawang school-based immunization program sa ilang paaralan sa bansa.
Pag-mimitingan pa yan kung ano yung mga next steps. It will depend on Secretary of Health, Secretary Ubial, at saka sa mga miyembro ng iba't ibang programa na may stake dito para kung itutuloy sa katulad ng mga sinabi niyong katanungan.
Nito lamang Abril, nagsagawa ang DOH ng libreng pagbabakuna kontra dengue sa mga batang may 9 hanggang 10 taon sa Calabarzon, Central Luzon at NCR. Subalit mula sa target na mahigit 1 milyong mga bata na dapat mabakunahan, nasa mahigit 400,000 lamang ang nagpabakuna. Paliwanag ng kagawaran, nahirapan silang mahikayat ang ilang magulang na samantalahin ang libreng bakuna dahil nataon ito sa bakasyon ng mga estudyante.
Paghila, ng mga pasyente, oras ng kumbaga bakasyon, tapos para iengganyo mo sila, ito lang yung kaukulang maengganyo mo.
Batay sa pinakahuling datos ng Department of Health, umaabot sa mahigit 66,000 kaso na ng dengue ang naitatala sa bansa simula January 1 hanggang July 16 ngayong taon. At yan po ang health update for this week mga kasambahay. Huwag muna kayong aalis, magbabalik po ang Doctors on TV.
Up next, let's find out the causes and treatment of colic, a condition characterized by babies' excessive crying, in Baby Talk, while learning the anatomy and physiology of our eye and what causes refractive errors when Doctors on TV returns.
Magandang araw mga mommy at daddy, mga kasangbahay. Ako po si Dr. Katrina Flor Cruz at ito po ang Baby Talk. Ngayong episode na ito, pag-uusapan po natin ang tungkol sa colic or tinatawag nating kabag. Ano nga ba ang kabag? Ginagamit po namin ang term na kabag para sa mga healthy, well-fed infants na umiiyak for 3 hours a day, 3 times a week, for 3 weeks. Nagsisimula po ito usually pagka ang sanggol ay 2 weeks old, pero ito ay humuhupa naman po pagdating ng 3 to 4 months. Bakit nga po ba nagkakaroon ng kabag? Ang sabi po ng ilang mga pag-aaral, maaaring ito po ay nangyayari kapag may sobrang hangin sa tiyan ng bata. Pwedeng dahilan din po ng nagde-develop pa po ang digestive system at ang nervous system ng bata. Pwede rin po ang kabag ay dahil medyo moody po ang bata o kaya naman po oversensitive lang po siya. Ano nga po ba ang iba't ibang paraan upang maigsan ang kabag ng isang sanggol? Bago pong lahat, siguraduhin muna natin na hindi po basa ang diaper ni baby, hindi po siya nagugutom, o kaya naman ay hindi po siya nagugulat or frightened dahil merong mga sudden noises or biglang nag-ingay sa kwarto. Kapag po si baby ay kinakabag, make sure na gawin po natin komportable si baby. So, ang gagawin po natin, pwede tayong magpatugtog ng mga lullaby o yung mga soothing music sa kwarto. Pwede po natin siyang ipaghele. Siguraduhin din po natin na maganda po ang circulation ng hangin sa paligid niya. Kapag po sa tingin nyo na si baby ay na-overfeed o kaya naman po ay bagong kain, pwede po natin siyang i-burp. Or pwede din po natin siyang ilagay sa posisyon katulad nito. Ang isa pang paraan upang ma-relieve ng colic si baby, pwede din po natin siyang iswaddle or ibalot sa blanket katulad nito. Ito po ay isang komportabling posisyon sa ilang mga baby at nakakapag-relieve din po ito ng kabag. Tandaan po natin, marami pong pwedeng maging dahilan ang excessive na pag-iyak ni baby. Kapag po tayo ay may nakitang simptomas tulad ng lagnat, pagsusuka, pagdadiarrhea, o kaya ay matamlay si baby at hindi kumakain, wag po tayong magdalawang isip na dalhin si baby sa kanyang doktor upang siya ay ma-check up. Yan po mga mommy at daddy. Ngayong araw, nag-discuss po tayo ng tungkol sa colic or kabag. Muli, ako po si Dr. Katrina Flor Cruz at ito ang Baby Talk.
Welcome back mga kasambahay to Doctors on TV. We're talking about refractive eye surgery with us, ophthalmologist Dr. Vic Santos. So Doc, ano ba ang kailangan para maging malinaw ang vision ng isang tao?
Okay, para maging malinaw ang vision ng isang tao, I have a brochure here, no, that will explain everything. Makikita po natin na ito po ang mata na hiniwa from the vertical side, no, para mapaliwanag, no. Critical po ang mga struktura ng mata. We have the cornea, the lens, at in between the lens and the optic, meron po tayong retina. Okay? Tapos, dito po may parang aqueous humor, parang tubig. Dito naman po may parang gel, no? Now, all of these are refractive media. Ano ibig sabihin ng refractive media? Pag dumaan ang ilaw sa isang material at nagpalit yung material, ang ilaw ay nagbe-bend, no? Yun ang basis ng refraction. Now, para po tayo makakita ng maliwanag, kailangan yung rays of light, ito pong dilaw na ito ay yung schematic diagram ng rays of light, they must be bent and focused to land exactly on the retina. Yan po ang tinatawag na emmetropia or perfect vision or 20/20 vision. Now, not all of us have this, no? Minsan po, dahil sa struktura ng mata, the rays of light get focused. Nakikita nyo, nasa harap na po siya, no? Yan po ang tinatawag na myopia or nearsightedness. Okay? Tapos minsan naman po, meron tayong situation na lagpas naman po siya. Ito naman po yung tinatawag na farsightedness or hyperopia.
So dito sa diagram, Doc, yung libro na nasa harap ng pasyente, malabo.
Pero ang ibon,
Pero may ibon na malayo.
Maliwanag.
Malinaw.
Okay? Tapos po naman, minsan, hindi ho, ito 3-dimensional na po tayo, no? Hindi ho pantay ang kurbada ng cornea sa iba't ibang meridian or axis, no? Maaring mas matarik dito, mas mababaw dito. So, ang kakaroon tayo ngayon, dalawang focal point, no? May isa sa harapan, isa sa likod. Ang tawag po dyan, yung astigmatism. No, ang astigmatism po, hindi yun not necessarily na binabaliwala kasi hindi ho lahat ng astigmatism ay mababa. Meron pong tinatawag na high astigmatism. Pag malaki po ang diferensya, no? So, yung iba, sinasabi astigmatism lang yan. Meron pong mga malulubhang astigmatism. Okay? Now, how do we correct it? Well, ang pag-correct po natin, either lagyan mo ng salamin dito sa harapan, o kaya maglagay ka ng contact lens so that the rays of light are altered before it hits the eye. Okay? Pero ang pag-uusapan po natin ngayon ay refractive surgery, no? So basically, ang refractive surgery, we do it on the cornea or on the lens, no? Now, ang ginagawa po na cataract surgery, akala nila it's just a curative medical procedure. It's also a subset of refractive surgery. Kasi ginagamit na rin po namin ang pagpapalit ng lente para pag-correct ng salamin. At ngayon po, pag nagkaroon kayo ng katarata, meron na ako yung option to go for a premium lens na makaka-enable sa inyo na makakita ng maliwanag sa malayo at sa malapit. Pero ngayon po, ang topic po natin ay refractive laser surgery wherein the action is at the cornea. So, pansinin niyo po, kung halimbawa, ganito po ang shape ng cornea, before the surgery. After the laser procedure, ganyan na po ang shape niya. And the difference is the equivalent of your glasses and contact lens.
Wow. Sige, Doc, before we proceed to treatment, alamin muna natin, bakit ba nagkakaroon ng mga problemang ganito sa cornea or sa lens?
Wala pong masisisi about that. Hindi ho makakatulong yung kailangan maliwanag yung ilaw o kailangan wag magbasa na magbasa o malapit sa TV. It's all basically an architectural or anatomical structure or a mismatch, no? So kusa lang po na talaga may mismatch.
Wow.
So this is something you're born with?
It's something we're born with. It's also something that develops over time.
Kapag tumatanda yung isang tao.
Kasi pag tumatanda, kasabay na rin ang paglaki ng mata, no? Although mas nagsistabilize siya somewhere between 3 to 5 years old, no? Pero in small increments, maaaring lumaki pa rin po ang mata.
Oo. So hindi pala totoo na yung mga bata kapag nakatutok sa television ng matagal, magkakaroon ng myopia o magkaroon ng...
Hindi po totoo yun, no? Kasi kung babasehan nyo lang po ang struktura, no? Nothing that you place in front of the eye can actually alter the shape and size of the eyeball, no?
So even reading at night, walang problem?
Wala po yun. It's just that you are hardwired to develop error of refraction.
Is there a nutritional deficiency that can predispose patients to these problems?
Yung pong mga nutritional deficiency, subject po yan ng health ng retina or optic nerve. And also the hydration of the cornea. Pero yung mismong struktura ng mata, we are born with it po.
Hindi mo mababago.
Hindi nyo mababago unless na pumunta kayo sa Fatima para babaguhin natin at para maging tama ang kanyang match.
Yan ang gusto naming malaman today.
So Doc, how do we assess vision of patients naman?
Well, you assess it, visual acuity test of distance and near. No? Yun ang pinaka-basic po. No? So, tingin po siya sa 20 feet away. Pag kamatch niya po, kita niya yung pinaka-mababa doon, then the patient is said to have perfect vision or 20/20. So pag narinig niyo po no yung numero 20/200, hindi ho yun maganda, yan po ay masama. Ibig sabihin po, you are at 20 feet pero yung pong normal na tao 200 feet away, pareho lang ang nakikita nyo. May pagkita ka na.
So kung 20/20, perfect vision.
Yes. Kung 20/20, perfect vision.
And as the second number gets bigger, that means worsening vision.
Or the first number gets smaller. Kasi minsan po, hindi na nakita yung pinakamalaking letra, gaya ng ating pasyente mamaya, no? She has to go 10 feet away from the chart to see the biggest letter. Yan po nagiging 10/200. 10/200 is worse than 20/200.
Okay.
10/200. Yeah. Wow.
It's basically fraction. Okay? The closer you are to 1, the better for you.
Yan din ba yung sinasabi lang, ang grado ng mata ko ay ganito, 200. Yan din
Iba
ba
naman
yun?
po ang grado. Ang grado po, yun po ay dahil chart subjective po yan, no? Ang grado po ay yung amount of change in the angle of the light po, no? Yun yung gaano mo babaguhin ang light bago pumasok sa mata para makorek mo. And ang unit of measurement po dyan is diopter. Yun pong diopter is the ability of parallel rays of light to get focus 1 meter away from its point of focus. So, ang tao po, meron po tayong 60 diopters, more or less, no? 40 or so coming from the cornea, about 20 from the lens, and then small diopteric changes in the aqueous humor and the vitreous jet.
Grabe no, si Doc, pinagkukwentuhan natin yung mismong structure ng mata, and we're talking about refraction, we're talking a lot of trigonometry here, Doc.
Trigonometry, it's a lot of math and geometry. You have to
Dapat
talk
pala
about...
magaling ka sa math kung mag-ophthalmologist ka.
Kasi mas mahirap ito dahil yung buildings kasi malaki, nakikita mo eh. Pero ito, very small, very, very minute ang...
And I'm sure you're all excited to see the new technology here at Fatima University Medical Center. Mamaya po, mayroon po tayong patient, si Miss Caroline Padayaw. She's been having visual problems. Ang labo na raw ng mata.
Ito daw, so far, nakita ni Doc ng worst.
Abangan niyo po yun mga kasambahay sa pagbabalik ng
Doctors on TV.
Up next, know what vegetables are good to eat while treating your eye condition in Naturally Yours. While experts will show us how eye problems can be detected early for prompt treatment. All these and more when Doctors on TV returns.
Magandang araw mga kasambahays. Once again, welcome to Naturally Yours. Today, pag-uusapan natin ang isa sa pinaka-importante na sense natin, which is eyesight. Pag-uusapan natin ngayon kung paano natin mapangalagaan ang ating mga mata para hindi ito mabilis masira. Mga kasambahays, tandaan natin sa Pilipinas or any tropical countries, nako, napakabilis masira ng ating mga mata dahil sa init ng araw. Especially kapag blue lights na ang tumama. Mga kasambahay, samahan niyo kami, pag-uusapan natin ang paborito kong juice na pwedeng tumulong sa atin sa pagpapalinaw o pag-delay ng pagsira o pag-deteriorate ng ating mga mata. Normally, naisip natin, kapag para sa mata, kailangan natin ng carotene. While it is true, totoo din na sa ngayong panahon na ito, mas maraming benefits ang makukuha sa mga green leafy vegetables. Meron din tayong kalabasa. Kalabasa is also very good. Mataas din sa carotene, which is also very, very good for the eyes. Pampapalinaw ng mata, pampapabright ng mata. Ngayon, nagpa-prepare tayo ng napakasarap na preparation of kale and spinach juice. Sir, pwede naming tikman yung spinach at kale juice, no? Mga kasambahays, ang kale tsaka spinach, hindi siya necessarily matamis, so you may want to add a little bit of pineapple or you might want to add a little bit of orange juice. Ang kale at ang spinach ay nagtataglay ito ng napakataas na lutein at zeaxanthin. Mga kasangbahays, keep in mind na makukuha natin ang best source o best quality with complete nutritional properties kapag ito ay nakuha natin sa whole food. When you say whole food, ito mismo ang pagkain, hindi siya synthesized. May mga lutein na source and zeaxanthin na sinisynthesize. Iba sila mga kasambays, it will not function the way lutein and zeaxanthin that comes from what we call whole food. And this one, ang kinaganda ng juice natin, especially if it is slow juicing, lahat ng nutrition macro and micro ay nakukuha natin. So kung anong merong lutein dito at anong zeaxanthin meron dito, ito ay na-absorb kagad ng ating katawan. Ano ba ang function at ginagawa ng lutein at zeaxanthin? Usually, nakakasira ng ating paningin ay ang tinatawag natin na blue light. Ang zeaxanthin at lutein, sila ang nag-absorb ng blue light na ito para hindi siya makuha ng ating mga mata. So that laging mapoproteksyonan at hindi mabilis mag-deteriorate ang ating mga vision. Kaya sa muli mga kasambahays, sana may natutunan kayo sa ating mga tips for this episode. See you again next week. Dito lamang yan sa Naturally Yours.
At nagbabalik mga kasambahay ang Doctors on TV. Still joining us, Dr. Vic Santos of Fatima University Medical Center. And now, as promised, we will be joined by our patient, Miss Caroline Padaya.
Good morning po.
Good morning.
Morning, Doc.
Morning. Good morning.
So, Miss Caroline, you've been complaining of poor vision since your 20s. You're now 40 years old. Lumalala pa ba ang problem?
Medyo stable naman na siya. Siguro 6 years ago na yung last na refraction ko. Same lang yung grade. Hindi siya nagbabago na.
Yeah, that's a perfect case. Kasi po, hindi ho namin pwedeng gawin ang laser procedure kung pabago-bago pa po ang grado. Kasi if the time will correct it, baka magbago pa naman after the laser procedure, may matitirang konti. No? So it's a good rule of thumb na more or less in the next 1 or 2 years, stable na siya.
Para ma-maximize yung
Yes.
benefit.
So I've been talking to Carol and she told me what her wishes are. Gusto niya po kasi maging free of eyeglasses. Kasi yun ang una niyang hahanapin for her to get going every morning. Obviously, kung hindi mo alam kung saan mo naiwan yung salamin, maaring madapa ka on the way to the bathroom or to brush your teeth and all that, no? We hope that we can put an end to that today. Okay? Pero sinabi ko rin sa kanya that there is a trade-off. She's 40 years old na pag tinanggal natin ang salamin, mas maaga siya mangailangan ng reading glasses. And she's fine with that. No? So, importante po sa unang bahagi ng pakikitungo sa pasyente, alamin ko ano yung hinihingi ng pasyente. At ibigay mo ang katotohanan at to manage your expectation. No? Dahil hindi po magic ito. Okay? Nung tinanong po na, unang ginawa po namin ay ikunin ang kanyang visual acuity. Obviously, the laser cannot do better than the glasses sa best correction. Kaya kinuha yung vista niya, she can see, nabanggit natin, 10,400. Okay, so kita niyo naman, kailangan siya lumapit 10 feet into the chart. The normal person can be standing 400 feet away. Pareho lang ang nakikita nila.
Okay, so she can see at 10 feet what a normal person can see or read from 400 feet away, no?
Apo.
So that's how...
Noong mga unang panahon, magic ang salamin. Kasi nung nagsalamin si Carol, she can now see 20/20. Well and good, no? So that's good. But in the modern age, we have a better magic, no? We have excimer laser and femtosecond laser, which I will explain later on.
Bagong machine niyo yan, Doc, no?
Bagong machine po siya, relatively bagong machine po siya, no? Now, si Carol underwent screening already, no? So, in-interview na namin siya, ginawa na namin siya ng best correction. The other steps are yung tinatawag na corneal topography. We'll show the machine later on. Basically, hinahanap niya ang mga kurba-kurbada ng cornea, yung harap na bahagi.
Alright.
Kasi yan ang papantayin ng laser.
Okay.
Okay? Screening rin siya para hindi natin gawin ang mga taong hindi kandidato. And basically, ito yung tao na may tinatawag na keratoconus.
Alright.
Ang ibig po sabihin ng keratoconus, yung kanyang cornea, imbis na pa-U, parang pa-V, no? Parang pointed, no? Delikado po gawin ng LASIK sa taong may keratoconus dahil lalo siyang lalala. At kung naging komplikado siya, baka mauwi tayo sa corneal transplant, no? So we don't want that. And good enough, we screened you and you are a perfect candidate. So you don't have keratoconus. The second part is we will check the thickness of the cornea. Nabanggit ko kanina na maliit ang measurement namin pero kailangan eksakto, no? We made an estimate that we need 15 microns to correct 1 diopter of grade. Nandito po, ang grade po ni Carol ay 500, no? So if you go 500 times 15, roughly about 75 microns of correction. The system, the protocol, gives us a limit of 120 microns na pwedeng i-correct. So kung halimbawa ang grade mo 1,000, malamang hindi ka kandidato. Pero ang grade mo ay 500 lang, pasok ka.
Okay.
Pasok ka.
So far, so good.
So far, so good.
Good candidate si Carol.
Yeah, and then we did the basic eye examination, check for corneal scars, check for cataracts, check for vitreous hemorrhage or retinal detachment or optic nerve pathology. Lahat yon pasado ka. And so right now, we're all set. Be prepared. We're about to change your life.
Doc, any other contraindications aside from keratoconus?
Thin cornea. Thin cornea, retinal detachment. Yung diabetic retinopathy and glaucoma, relative contraindication siya. As long as you explain to the patient na it can go on, that the refractive correction did not change your status in the glaucoma or in the diabetic retinopathy.
Told earlier, Doc, nabanggit nyo, no? Paano yung may mga buntis na gusto nilang magpa-LASIK?
Generally, we do not want to do elective procedures on pregnant women because the studies on the effect of laser, even the ambient radiation, there are no studies to that. So, we don't know what the effect is.
Mas maigi.
Mas maigi, antayin na lang mga anak po muna. No? At nagkakaroon din ho ng mga pagbabago sa mata in the course of pregnancy.
Can we do this at any age? Like in your 20s, pag poor vision, pwede na.
Our minimum is 18.
Okay.
But that's a sliding minimum. Kasi meron po mga special situation, for example, special children with very high grade, we don't want them to get amblyopia, yung tinatawag na lazy eye. And there's some special children na hindi mo pwede lagyan ng salamin or contact lens because hindi sumusunod, no? So yung sa mga ganun sitwasyon, mas bata sa 18, general anesthesia, we do PRK, no? Yung PRK. We are now in the 3rd generation of laser technology. Yung unang teknolohiya po, ang tawag po dyan ay PRK. Ito po, diretsyong tinitira ng laser yung surface ng cornea. Okay? It's enough energy to cleave a molecular bond of the cornea, so nagiging gas siya, na nag-evaporate. It's very good, it's very reliable. In fact, I did this to myself. The only
Okay.
I did this in 2007 when our laser was new. Ang drawback lang po nito, it's painful. We have about 2 days of discomfort. Okay. But you'll get, all of these procedures, you'll arrive at the same thing. The second one is called LASIK, but in our case, we will be doing femtosecond LASIK technology today kay Carol. Basically, ang LASIK, gagawa tayo ng flap. The flap can be made by a microkeratome, which is a blade that is computerized. It will run through the cornea, create a flap. The bed is the one that is hit by laser. Okay? But because we don't want to have fear in the equation, hindi po blade ang gagamitin natin ngayon. Ang gagamitin natin ay femtosecond laser, no? So pansinin niyo po, dalawa po ang laser namin dito sa aming kwarto. One is a femtosecond laser, the other one is an excimer laser. So yung excimer laser, yun ang ginagamit sa PRK at sa LASIK. So femtosecond LASIK, we use 2 lasers. The first one, the femtolaser or femtosecond laser, incidentally, the femtosecond is a measurement of 1 quadrillion of a second. No? So you take 1 second sa ating relo, you count 15 zeros to the left of it. Ganong kabilis ang femtosecond, no? Lahat po ng tatamaan ng laser, no? The tissue surrounding it beyond the reaction time of heat. So hindi po maapektuhan. So mangyayari lang po, meron po mga bubbles na makikreate within the surface of the cornea, within the stroma. Tapos a blunt instrument, non-sharp, will go through the side, okay? And then we will just slowly dissect it. Very, very safe. Time and time again, very, very accurate. Nothing wrong because you did not use a blade, you will never have a blade-related complication. Tapos po, ililipat siya dun sa kabilang laser where the basic excimer laser will be done. Okay? Dati po, nabanggit ko na rin po, ang ating 3rd generation na laser procedure, it's called SMILE. No? Dahil napakita na ho namin siya last time, today we'll be doing something different. Pero ito po ang state-of-the-art technology. So instead of creating a flap, we create a lenticule inside and we simply dissect and remove it. Yan na po ang correction. In about 3 minutes or less, we have done the correction for the patient.
Okay, so ito, Doc, yung gagawin sa kanya.
Ang gagawin po natin ngayon ay, ang schedule po natin ay femtosecond LASIK.
Dok, linawin ko lang, some for diabetic patients get laser treatment for the retina naman.
Yes.
Kasi when you say laser, baka magkaiba yung sa retina, magkaiba yung sa cornea.
Well, yes. When you talk of laser in ophthalmology, easily 10 kinds.
Okay.
So, alamin niyo kung anong klaseng laser po ang ginagawa, no? I don't want to enumerate everything, pero basically, ang laser for diabetic retinopathy, dito po, in between the blood vessels ng retina.
Okay.
Suma total, mga 1,000 tama po yan ang gagawin in the course of 3 sessions.
But what we'll be doing today is we'll be targeting the cornea,
Yes.
this part here naman.
Cornea.
Okay.
We consider it non-invasive because we did not penetrate the ocular wall of the eye.
And mamaya mga kasambahay, Miss Cara will actually have the opportunity to undergo bladeless LASIK surgery here at the Fatima University.
Yeah, so na-explain naman lahat no ni Doc very well. And so, Miss Carol, ready ka na ba?
Yes, ready na po.
Ayan. So mga kasambahay, huwag po kayong aalis at antabayanan ang procedure no para kay Miss Carol. Kaya huwag po kayo aalis at babalik po ang
Doctors on TV.
Up next, Why are women more prone to urinary tract infection than men? Let's know the reason in Women's Health. Find out also the latest technology in treating eye problems without the need of wearing eyeglasses or contact lenses. When Doctors on TV returns.
Magandang araw mga kasambahay. This is Dr. Steph Supan for another episode of Women's Health. Ang pag-uusapan natin ngayong araw na ito ay isa sa mga kondisyon na madalas ma-experience ng mga kababaihan. Ito ay ang urinary tract infection o UTI. Ang UTI ay mas common sa mga kababaihan dahil sa ating anatomy. Ang urethra o ang daanan ng ihi mula sa pantog hanggang sa labas ay mas maikli, kaya mas may time na umakyat ang bakterya mula sa labas. Ang UTI ay common din sa mga pregnant women dahil kapag buntis ang isang babae ay mas dilated o mas open ang kanyang urethra. May iba pang risk factors ang mga kababaihan that makes them prone to UTI. Ang paggamit ng mga birth control methods kagaya ng IUD o diaphragm na nag-i-introduce ng foreign body sa ating vagina ay maaari ding mag-attract ng mga bakterya o infection. Ang karaniwang mga nararamdaman ng isang babaeng may UTI ay ang masakit na pag-ihi, lalo na sa may dulo ng pag-ihi. Maaari din namang burning sensation o parang sobrang mainit ang ihi kapag ito ay dumadaloy na. Ang iba naman ay nakakaramdam ng pagsakit ng puson o ng balakang. Maaari din silang maka-feel ng urgency o ang sobrang nagmamadali tuwing sila ay naiihi na. May iba na walang nararamdaman pero mapapansin nila na ang kanilang ihi ay cloudy or bloody. Ang pinakasimpleng way para ma-check ang UTI ay through urinalysis. Kapag magpapa-urinalysis, dapat ito ay midstream. Huwag sasaluhin ang unang labas dahil ito ay natural na may bakterya. Kalagitnaan hanggang huli ang pwedeng sahurin. Kapag na-diagnose na ang isang babae na may UTI, ang kadalasang ibinibigay ay ang antibiotics o antibacterial medications. Maraming klase ng antibacterial medications at dapat magpakonsulta sa doktor para malaman kung ano ang pinakaangkop na gamot para sa inyo. Kapag niresetahan kayo ng doktor ng pang 3, 5 o 7 araw na gamot, ay dapat itong kompletuhin kahit na kayo ay wala nang nararamdaman after 1 or 2 days lamang. May mga paraan din upang maiwasan ang UTI. Unang-una ay ang pag-inom ng sapat na fluids. Dapat ay umiinom tayo ng 6 to 8 glasses of water a day. Ang pag-ihi din ng regular at huwag mag-aantay ng sobrang ihing-ihina ay isang magandang paraan din para makaiwas sa UTI. Sa paraang ito, hindi magkakaroon ng time ang bakterya na umakyat papunta sa ating pantog or kidneys. Ang hygiene ay importante din. Ito ay importanteng sabihin lalo na sa mga kabataan. Iwasan din natin ang paggamit ng mga scented products kagaya ng feminine wash at panty liners. Kung tayo man ay gagamit nito, dapat itong pinapalitan ng mas madalas o kaya ay gumamit ng mga unscented products. Ang mga babaeng mataas ang blood sugar or may diabetes ay mas prone ding magkaroon ng UTI. Importante lamang sa kanila na panatilihing mababa o normal ang kanilang blood sugar. Maraming mababasa tungkol sa paggamit ng cranberry para mag-treat ng UTI. Ang cranberry ay isang prutas na usually nakikita in a form of a juice. Sa ngayon ay hindi pa consistent ang mga studies na nagsasabi kung ito ay talagang nakaka-treat ng UTI. Maaari itong gamitin as a drink para dumami ang ating fluid intake but not as a treatment for UTI. Ayan mga kasambahay, sana ay marami kayong natutunan ngayong araw na ito tungkol sa urinary tract infection o UTI. Hanggang sa susunod na linggo, this is Dr. Steph Supan for Women's Health.
At nagbabalik mga kasambahay ang Doctors on TV. We're now at the laser room of the Fatima University Medical Center. With us, Dr. Vic Santos and our patient, Miss Carol, who will soon be undergoing bladeless LASIK surgery. Doc, dalawang machine ang sinabi niyo, no? Can you explain po what the machines are for?
Okay, the first one, and Carol's right underneath, it's the femtosecond laser. This one will create the flap. Okay? After that, we will swing Carol to the other side where there is the excimer laser. That will do the photoablation. So flap, then ablation.
Kanina na kinuha natin ng consent si Miss Carol. Is there anything that she can expect to feel during the procedure?
Well, nothing. There'll be a slight pressure when the cup touches her eye, and just temporary blurring of vision because of the bubbles.
There's no need for anesthesia or sedation.
We have an anesthesia that's topical. I think it was given to her already.
Alright.
Drops.
Okay, so ready ka na, Miss Carol?
Ready, Carol? Okay, so we're all set. So we covered the left eye of Carol. I will be putting an adhesive tape sa eyelashes nyo. Okay. I'm just focusing on the eye first.
Okay, double check. Patient Padayaw, Carolina, right ma'am? Okay, we're doing first the right eye.
So I will be putting adhesive tape, no, Carol? Tapos, look down please. Tapos maglalagay tayo ng instrument, pampa-open ng eyelids mo. It's best to keep both eyes open kahit dun sa naka-cover, no? So in a few seconds, we'll be docking the eye to the instrument. Okay, diretso lang ang tingin, ha? You will see a green blinking light. Dun ka lang titingin. Okay, so this is now the docking procedure. Open both eyes. Just look straight up. Don't look for it first.
Look straight lang, ma'am.
Straight up lang. Okay. I'm now docking the eye. No? Where your eyes are now, dyan lang ang tingin, ha?
Steady lang po ma'am.
Try not to move. We're zeroing it in. Okay. The ablation has taken place. Okay. Everything went well. So the flap has been created. I'll just leave it like that while I work on the other eye. Right now, you see the cornea to have air bubbles inside.
Okay.
Then we will dissect through that when we do the laser ablation. No? So, kompleto ng ating straight lang. So, I'll just leave this alone and then work on the other eye. Everything went well, no, for this right eye. So, lilipat na tayo sa kaliwang mata, Carol. So, I'm now transferring to the other eye. Same thing, no? Tatakpan natin ng right eye mo. So you did very well, Carol, ha? Lilipat na tayo sa kabilang mata. Okay, so we're all set. Okay, just look straight, ha? Exactly what we did to the... don't shake your head, ganyan lang. So we'll just clean the surface of the cornea para mas maganda yung adhesion niya, no? Try not to move, ha, Carol. Ganyan lang. Is that good? Steady lang. Steady? Okay, good. You'll see now the photoablation taking place. There. Those are the air bubbles that you see. We'll create a side cut for the flap. There. Nakita yung line doon? Okay. We will now transfer you to the other laser. We're here on the other side, no, of the room where the excimer laser is. A flap has already been created by the femtosecond laser. Okay. Yung water lang. So I will now dissect it. Relax lang, ganyan lang. We're just dissecting it. Okay, the flap is created, okay? So we'll now do the laser ablation. Open both eyes. Try to look straight lang, Carol. Okay, try to look straight lang. Okay, you're doing well. Okay, we're ready to laser. Try not to move. Oh, you're doing okay. Ready?
Yes,
Okay, doing well. Yeah, the eye tracker follows the eye even if it's moving. Carol is a bit, yeah. Okay, 84%. Okay, we're done. Okay. So we'll just return the flap and then we will let the flap attach back. It will just grow back on its own. It will attach on its own. Okay, so tapos na tayo. Waiting time lang tayo 2 minutes. So for these 2 minutes, we won't be doing anything except wait. It will adhere instantly. Okay, but may parang interface pa eh. So it will take about a couple of hours before she sees clearly.
So it's a very quick procedure lang pala, no?
Well, this is one of our longer procedures because there's some adhesion in the very slight adhesion. Carol, we're working on the right eye. Look down, please. Okay. It's best if you keep both eyes open and try to minimize movement in your eyes, no? Okay, or your head. Okay. So, what you will expect, Carol, hindi pa siya ganun kalinaw, but it is a lot clearer than nang wala kang salamin, no? I'm sure you know your vision when you don't have eyeglasses. Sometimes we have patients who are so scared, they want to do it one eye at a time, so that if something goes wrong, we try to prevent that because it's very, very safe. And it's very, very convenient to do 2 eyes at the same time. I'm gonna open both eyes. But right now, she can clearly see.
Okay.
She can clearly see things that she was not able to see before. Still scared? Still scared. The only post-operative care is no rubbing. Congratulations. Thank you, thank you.
So, Doc, tapos na yung procedure. And we can remove our mask
yes,
already.
Yes, we can remove our mask already. Okay, and then we'll give a chance, no, to introduce my very, very efficient staff. This is Christian, Aldrin, and Jeff. They've been with me for several years already.
Oh, expert na expert, sir. Sanay na sanay sa procedure.
You're in safe hands here at Fatima.
Oh, very fluid yung pag-perform ng procedure. Sir, any final words po sa audience natin?
Kung gusto niyo po ma-experience ang buhay na walang salamin or contact lens, please feel free to call Fatima University Medical Center. And smile and see the world clearly.
It's a very easy procedure, sir. As outpatient, it can be done. Give us a bird's eye view na lang, sir, on how much the procedure costs.
Well, it's very competitive and it's very reasonable. So, hindi po siya magiging hadlang sa sino mang may gusto. Tapos we are partnered with some other banks who can give extended payment or even a loan. There are some banks which are partnered with Fatima. You can actually have a loan, so we can have a LASIK now, pay later.
And Doc, you have the contact number of Fatima Eye Laser Center.
It's very easy to remember. Just remember 2020. It's 291-2020. It's our number. It's our intention.
Okay, so thank you very much, Dr. Santos.
Thank you very much.
We
Thank
learned
you.
a lot about this during this episode, and I'm sure our patient really benefited a lot.
Yeah, I hope Carol will be happy.
Okay, huwag muna kayong aalis, mga kasambahay. Magbabalik pa po ang
Doctors on TV.
Up next, get tips from the medical experts on how to keep our eyes healthy when Doctors on TV returns.
we are nearing the close of today's episode. Thank you mga kasambahay for joining us. Truly, the eyes are the windows to the soul. Yes. And talaga yung mga most appreciative patients na nakita ko, yung mga dating mahina na ang vision, and then the ophthalmologist does a surgery or procedure to give them back their vision. Sobrang appreciative talaga yung mga patients.
Kaya sa lahat ng senses natin talaga, yung mata, vision ang pinaka-importante. Kasi otherwise, hindi natin ma-appreciate yung beauty ng nature, no?
Exactly.
And I hope I don't need to undergo this procedure anytime
I don't
soon.
think so.
Hindi pa. Few more decades.
Few more decades. Bata pa tayo na.
Pwede naman maiwasan kasi sabi nito.
Actually, pwede,
So, let's keep it that way.
Take care of our eyes.
Take care of our
And
vision.
if there's some problems, see a doctor soon.
Right away.
Correct.
An ophthalmologist.
An ophthalmologist.
Especially, yes.
Of course, we would like to thank all the doctors and staff of the Fatima University Medical Center, especially the Eye Center. I'd like to thank the Medical Director, Dr. Oscar Payawal, and Vice President for Operations, Ms. Ava Maliwanag.
And also to Ms. Ade Sullivan, the Marketing Assistant, and of course, to Dr. Vic Santos, the President and CEO, and our guest today.
Ayan. Thank you also to Walter Bread, all yummy, no tummy, the healthy bread on everyone's lips. And of course, Fiber C, the only real time-released vitamin C. Ito my clinic, LRT Integrative Medical Healthcare Clinic in Olongapo City. And of course, the Chef Royce Pulatao of Royce Cakes and Cupcakes. Thank you.
And of course, thank you sa mga nanonood sa atin sa Quezon City, especially sa mga kamag-anak ko, the Tusit family.
Thank you also to Tawi-Tawi Medical Center. Thank you for supporting us every week. Until next week, mga kasambahay, be safe and stay healthy. Magkita po ulit tayo sa susunod na linggo, dito lamang sa
Doctors on TV!